Order. Call the honourable member for Wakefield.
Well, thank you, Deputy Chair, and it's great to be here. And it's wonderful that the government backbenchers stuck around to discuss Medicare. And I know their great hero John Howard in 1987 said he wanted to stab Medicare in the stomach. That's what he said. That's what John Howard said, and that's what this backbench wants to do. They want to gut Medicare. They want to get rid of Medicare. That's what you're doing. That's what you're doing. Now, the essential parts of Medicare are its workforce, are nurses, who are an essential frontline part of this system. Absolutely no doubt. Along with doctors, along with the allied health professionals, they're the sorts of people. We should be listening to. But what do we get from the government backbench? Well, I tell you, you don't get them listening. You get this defence of the government's budget. Well, at least sometimes you do, at least sometimes. By interjection, not by speeches, not by standing up in the parliament, putting themselves on the record, just by interjections, just by showing up for these debates. Well, I tell you who's against the government's changes. The AMA, the College of Emergency Physicians, the Doctors Reform Society, the Public Health Association, the Royal Australian College of General Practitioners, the Consumer Health Forum, Australian Healthcare and Hospitals Association, and countless others who are against it. And what are they against? They're against the GP tax. $7 every time you walk into a waiting room, every time you get a blood test, and think about it, $7 every time. It's a cascading tax on Australian families, a cascading and compounding tax on Australian families. And those opposite are out there giving their constituents the wrong impression, alleging there's some sort of safety net out there, but we all know that safety net is not defined. We haven't seen hide nor hair of it out there. All we know is $7 every time you go to a waiting room, every time you get a blood test, every time you go anywhere near a doctor. That's the nature of this policy, and that's why it smashes Medicare and it smashes preventative health care. Now, a doctor in my electorate, or just outside my electorate in Salisbury North, Dr Bruce Groves, I used to go to this surgery, and he wrote to me, and you might want to listen to this. This is not the Labor Party, but he said, to the Honourable Nick Champion, "Dear Sir, I wish to draw your attention to the massive reduction at my practice of patient numbers since the budget announcement RE co-payments in general practice. Our practice of 8 doctors, a non-corporate teaching practice, has noted a 30% drop in attendance since this announcement. 30% drop in attendance. We are now trying to reassure patients that this measure will only come in if passed by both Houses of Parliament in July 2015. Patients are confused and upset. We, the doctors, working in a working-class suburb with many pensioners and concession card holders, are angry and appalled by the proposed co-payment measure, which may well destroy our practice and others in the region, given the response already. The measure is heartless, bereft of social conscience, and punishes those who can least afford it." That's what Dr Bruce Groves says from Salisbury North. That's what Dr Bruce Groves said. And none of you are listening to your electorates. None of you are listening to the AMA. None of you are listening to general practitioners in your electorate. And it's a serious problem, because every time someone doesn't go to the doctor, it creates bigger problems down the track. We all know they end up in the emergency departments, they end up in our hospitals, and that will put more pressure on those nurses, more pressure on the frontline services, more pressure on our hospital system. And there will be no savings. All of the mythical savings that the minister talks about going into this wonderful research fund will not appear, because what will happen is this is simply a cost-shifting situation. If you charge at the GP end, then you will make our hospitals less efficient in the long term. Now, Deputy Speaker, we hear a lot of interjections from those opposite, but make no mistake, this GP tax, a cascading $7 every time, combined with the $50 billion worth of cuts, are going to cut nurses, some 4,300 hospital beds, 1 in 5 nurses, and the government backbench might show up and they might interject, but we won't find any of them out in their electorate actually defending this policy come election time. They hope it's defeated in the Senate. They hope that Labor Party successfully defends Medicare. That's what they hope. They hope that this budget isn't implemented.
Order.